name is Jenna Jones. I am an FACJ nursing student, and I am doing a piggyback IV with a mini bag. I'm going to start by verifying the doctor's order against the patient's MAR, checking for allergies. I'm going to verify the correct dose, route, and frequency of the IV. I will assess the correct lab values and data, and of course, the patient allergies. Okay, so I'm giving 500 milligrams of vancomycin every 6 hours, and I have 100 milliliters in my bag, and it's over 6 minutes, so it's 70 drops per minute, because my drop factor is 10. With normal saline running on the primary bag, vancomycin is an anti-infective, and it's for the treatment of potentially life-threatening infections. It has a bactericidal action. It is contraindicated in hypersensitivity. The side effects are ototoxicity, nephrotoxicity, nausea, vomiting, hypotension, rash, red man syndrome. The dose I'm giving is 500 milligrams every 6 hours. I'm going to assess the patient for anaphylaxis. I'm going to take the culture and sensitivity before the first dose. I'm going to watch for superinfections, and I may need to slow it or dilute it. And then I'm going to assemble my meds. So, I have my 1 milliliter. I'm going to wash and glove my hands.
I just marked this so this is over. So look, that's one of the steps. And then on the measure, you measure it, you start here like that. You go flat. And then that's the mark.
I'm going to draw back my hair. And I'm going to clean my medication off with alcohol, let it dry, and I'm going to insert my air, and I'm going to invert my medication. And I've already applied my label to my mini bag. So now I'm going to insert my medication into my mini bag. I will discard my needle, dispose of it in a shots container, and I'll change it when it's 2/3 full. Now with my mini bag tube already labeled with my client's name, the date, the dose, and the time for my initials. Making sure that this is clean. I have clamped my primary tubing. check my IV site after I clean it with alcohol. It is patent, no signs of phlebitis, inflammation, and infiltration. Of course, after I have already identified my client and reassessed for allergies and explained the procedure of the IV. I've already hung my mini bag up higher and my primary down. So now I will unclamp my mini bag. Then I would establish the flow rate for the mini bag, which is 17 drops per minute, which is what my math was. And I will observe the infusion periodically until complete. And then once I have began it and the patient's taking it through well, I would unglove and then rewash my hands. Then when it's complete, I would clamp my mini bag and unclamp my primary tubing, which is also labeled. With another alcohol. After I have washed and regloved my hands, another alcohol pad. And clean this port. With my mini bag clamp, I will then reattach the primary tubing. And I would unclamp my primary. Then I would reset the flow rate back to the physician's orders after the primary bag of the IV. Then I would dispose of everything correctly. Of course, the needles are disposed of in the sharps container, and I would empty that one at 2/3 full. I would monitor the IV site, make sure no phlebitis or infiltration. Then, using my MAR, I would document the time, drug, dose, route, initials, date, and using the MAR intake and output record, I would document the volume of the fluid. And I would also note the condition of the IV site.